welcome to another episode of Healthy Talks. I'm your host, Judy, and today we are with the incredible Ola from Australia, who is a mental health nurse. How are you doing today?
I'm good, Julie. How are you?
Thank you so much for coming onto the show. We really appreciate it, and I can't wait to hear all your insights and journey into healthcare. So you started your healthcare journey in 2020, right at the onset of the pandemic. How did that unique timing shape your experience as a mental health nurse?
Thank you, Julie. It was a very challenging time. I remember that time we were so focused on um, physical illnesses, how to avoid being infected by COVID, but there
Mm,
was very limited conversation about people living with mental illness. There was a lot of people who suffered from social isolation, which was in their mental health. A lot of people who actually became more distressed and more
mm,
psychotic as a result of mental illness. A lot of people with OCD suffered a lot then. Also, we have a lot of people that had some kind of like um, schizophrenia.
yes.
They became very, very, very unwell at that time. So there was a lot of challenge then, and the problem was that the whole world was focused on physical illness, so that we got like very, very limited support for staff and everything. So it was very difficult time.
No, I
Yeah,
can definitely imagine.
yeah.
And you've worked in both community mental health and inpatient psychiatry. How do these roles differ in terms of the challenges and the rewards that you've encountered?
When it comes to inpatient unit, I worked briefly in community before I went in there, and I really appreciate the fact that I did. And the reason is that I was able to see people that had mental in their best
Mm,
possible form. When like people who they had recovered from a psychotic breakdown, from this psychotic episode, and they are getting integrated back into the community. It was quite a very, very different presentation. It gave me hope. It gave me a different insight. And when I left, then going into the inpatient unit, I I approached my job differently with so much hope
yes.
because I felt okay if I can see sorry, I'm using your name, Julie, in that
Yes.
state that was looking very well. I have hope for this fellow who is looking very unwell, who is acting irrationally, who is being very psychotic, who's becoming very aggressive. I have hope for him, and I'm looking after him with that hope, and it's
Yes.
actually reflecting on the way I'm doing my job. So I really appreciated that fact. Yeah, it was very good.
Well, that's amazing. It's nice to hear how other people have affected how you do your job and how you go forward in healthcare.
Yeah, yeah.
And you mentioned when we spoke previously, with your transition to forensic mental health. What drew you to that field and how does it compare to other areas of mental health care?
When I do my job, every time when I try to get a job, it's actually because I'm curious, wanting to learn more. Like every job will pay you anyway. So why leave a job when it's paying you already? I am always quite intrigued by different areas of mental health,
Mm,
and I really appreciate the fact that I went into mental health because it's got so much facets in it, so much areas where you can work and where you would have to learn every time you learn more. So I went into forensics because um, I look at the news every time and they can to tell you about something happening to this person. He has committed this crime, and after a while, they tell you that he was suffering from schizophrenia, and that is why he did this. Oh, he had ADHD. He had depression,
mm,
anxiety, different kind of stuff, and it kind of like struck me in a way that actually we have as a society the court of public opinion kind of like automatically judges people that have committed crime, especially if it's a high profile case. No
yes.
one gives anyone the benefit of the doubt. And when you hear stuff about mental illness, people kind of like shrugs it off and be
Mm,
like, just an excuse. So I went into it because I wanted to actually see what is happening right behind those closed doors, because you can't see if you don't work there. And actually getting there, it showed to me that a lot of things are happening to people and they end up where they don't plan to be in their
mm,
lives. And a lot of people are going around with so much trauma, so much untreated mental illness, so much depression, so much anxiety. Some of them are drug induced, some of them are really like just natural ones, and they are not treated. And at the end of the day, you only find out when they have done something significantly wrong, and when the attention is on them. So the reason I went into it was just to find out and to learn how actually there are people who don't get access to
mm.
what we do and end up in very precarious situations and end up committing significant crimes.
No, that's definitely true. There's a lot of people, because of that stigma around mental health, they don't go and to a doctor or to a psychologist to find out if there's something wrong. They just leave it untreated, and that's very dangerous for themselves and to others around them.
Yes, yes, exactly. You're
And
correct.
given your experience, diverse experience from case management to forensic mental health, you just spoke about, what's been your most valuable lesson that you've learned in your career so far?
Can you come again?
What's the most valuable lesson you've learned in your career so far from all your diverse experience?
I would say I would say two very important experiences, and two is important lessons, and the one is to actually don't take anything on face value. Just do your research by yourself, like find out by yourself. I had a person who was a client of ours. He came into our service and was expressing a lot of um, a lot of ideas which we would say are grandiose ideas. He said
Mm,
he used to belong to a band, he used to write books and everything, and the way this man presented looked exactly opposite. Okay. I mean,
mm,
he looked disheveled, he looked so unwell, and he was saying stuff like this, like, I have books, I've written two books, I've done this, I've done this. I used to belong to a band, a very popular band in Melbourne, Victoria. And most of our nurses like just shrugged it off and be like, this is one of those things. He says
yes.
this and he's so well. But over time, I sat down with him. I researched on everything he said. He was 100% right. He was like a two-time author, good books. He
Wow.
he was part of a band. I saw the video on YouTube. Everything checked out fine. But because we he was unwell, we already put him in that box, and
Mm,
we believed that he was actually who we thought like we he was, just because we see these things every day as nurses. I've learned
yes.
that you have to sit down with this person because human beings are not what they present to be. They are we are all a product of our experiences and our life
Definitely.
situations. Okay. Like we were all born, most of us, apart from some few, we're all born the same, and
Mm,
some of us carry along our experiences and it shapes who we become in future. But if we sit down and ask questions, we'll find out that people were actually right.
yes, definitely. That's such a great
Yeah.
way of looking at it and looking at people like,
Enjoying this episode? Ever thought of starting your own podcast? Podup.com is your go to. They've got everything you need to run a pro show, including 35 or more AI powered tools for success. Sign up today for a free starter account and get 15% off with the code HealthyTalks15. The code is HealthyTalks15. Plus, check out podallies.com for a done for you podcasting experience, complete with a website, social media, and editing. Start now and let's launch your podcast together.
Just don't put them in that box and don't judge them by the cover. Like, actually took that time to get to know the person and went and did your research. That's
Yes, yes,
amazing.
yes.
And mental health has become such a more openly discussed topic. Yet you mentioned in our previous discussion the ongoing stigma in places like Africa. How do you see culture beliefs impacting mental health treatment worldwide?
I actually told you the other day that it's like in Africa, it's very hard to like come out with your with whatever is wrong with you and
Mm,
say, "Oh, I'm looking unwell," and all that. It is very, very difficult. But the truth is that we have come a little bit further for how we've been. It's it's been very hard to actually say that somebody has mental illness in Africa. However, it's becoming better. Okay, it's coming
mm,
better. And when you say how cultural beliefs get to impact on mental illness worldwide, I believe number one is the perception of mental illness needs to change.
yes.
Um, in the whole world, I know about the Western world here. The perception is different. We need to take away the stigma from mental illness. Because back at home, mental illness associated with a lot of maybe weakness,
Mm,
some moral failing, some kind of like witchcraft, even. So there's a lot of things that people attach to mental illness back home, which is ridiculous and not true. But these things influence the way mental health treatment is worldwide, and we need to work on that. Another thing is the traditional healing process. So back home,
mm,
because some people believe it's witchcraft and stuff, some people believe that you can only treat stuff like this. Um, in the traditional ways. I don't believe it's totally wrong. However, I think that should be incorporated, and we should be able to do more research into whatever ways people think they can look after people living with mental illness, and see if we can incorporate that into our Western ways of looking
mm,
after people. Yeah. Also, in many cultures, family involvement is very important. Um, I know much about Asian people. They try to look after themselves. The family are very involved, which is very, very, very beneficial. So if there's enough family involvement and the community dynamics favors something like that, I think that will also help. In terms of looking after people with mental
mm.
illness. Yeah. Uh,
Definitely.
yeah.
It takes that support in that community around you to help.
Yeah. There's a lot of other ways that the socioeconomic factors also are there, the language and communication, because the language people use towards people living with mental illness is ridiculous and terrible. That also can be um, worked on.
Mm,
Also, there needs to be more educational awareness around the world around how people perceive mental illness. So yes, I think hopefully we can get there.
yes, definitely. So I also hope we do get this.
Yeah.
You spoke about self-care being a challenge for mental health workers. What are some of the
Yeah.
practices or strategies you believe could help nurses and healthcare workers maintain their mental well-being?
Number one, I think um, we can talk about um, I for someone like me where I work, they do as much as possible to help to improve the well-being of nurses. However, there is a lot of things. There's a lot that we can still do. We can work on the work ratios. Okay, it's
Hmm.
very hard to actually do your job well when you are actually going out of ratios. I think that is a very common problem around. mental illness and mental health workers. We are
Mm-hmm.
all aware of that. We need to also work on remunerations. It looks like, yeah, mental illness, mental health nurses are getting well paid, but I also believe we can still do more, and we need to improve in our work-life balance, supportive work environment, professional development. There's a lot of ways, strategies that can help nurses to
Mm-hmm.
maintain their well-being. And also, we have what we call in Australia, we have what we call EAP, which is an employee assistance program, which gives you the opportunity to speak to someone, a therapist, whatever it is, when you face a very difficult day at work. Recently at my workplace, we had an issue at my workplace, and
Mm-hmm.
some of us had to use EAP. So it's very important that we make sure that we support nurses as much as possible when they are facing difficult periods, and that is one of those things. Yeah, I think yeah, those are the
That's
strategies we
true.
can use.
That's definitely true. And PTSD is also a common issue for those in high stress jobs like yourself in nursing, policing, and emergency services. What do you think are the best ways to support healthcare workers who are struggling with mental health challenges themselves?
What did you mean? What did you say again? Can you come again?
PTSD is a common issue for those in high stress jobs like nursing, policing, and emergency services. What do
Yeah.
you think are the best ways to support healthcare workers who are struggling with mental health challenges themselves?
Oh, yeah, that's a very good one. You remember when I said something about EAP?
Yes.
Yeah, that's a very important intervention that can help by providing access to mental health services to make sure that we as mental health nurses are not only looking after people with mental illness, but we are also able to be looked after when we are not feeling
Mm.
well. In Melbourne, Australia, we have some hospitals which are specific mental health facilities for emergency workers. We have one in, I don't think I should mention the name, but there's one
Yeah.
in, uh, there's one in Heidelberg that would provide specific mental health um, services for people that worked in military, policing. I'm not sure about mental health nursing, but mostly emergency services. There's
Mm.
a specific mental health facility for them. Also, the workplace culture needs to improve, providing a very supportive workplace culture that normalizes mental health discussion, reducing stigma, the fact that I'm in mental health nurse does not mean I can't be struggling. So reducing that stigma, making sure that I have the support of my colleagues and managers also is very important. Open conversations,
Mm.
also training and awareness, providing enough training and awareness for us, for
Yes.
mental health nurses, for doctors, for police, for emergency services. Training is very important on how we can look after ourselves and look out for signs of PTSD and mental issues. Those are very, very important steps that we can take.
Mm.
Also, we can also do some regular check-ins. We have something like that, which is you talk to somebody in your line leadership, how you're going, just a checkup with your supervisor. How are you going? What do you need to do your job well? Very important, and we do that very well. So that I can say we are getting that, and also some resilience, coping skill training.
Mm.
Very important, very very important. Those peer support programs, those resilience trainings, they are very very important. Yeah, those are the ways we can help ourselves. I think. Yeah,
Definitely.
yeah,
And you mentioned in the last conversation that some of your colleagues have left the mental health nursing field. What do you
yeah.
think can be done to make this profession more sustainable and fulfilling for those who remain?
You remember earlier I said staffing levels. That
Yes.
is a very important part because when people leave and there are very few people remaining, um, there's more work for us to do.
Mm.
So if we were 10 nurses on a shift and now we are six, it doesn't mean the people
Yes.
suffering with mental illness are going to change. So we six, we will have to do the job of 10 people, and more, it becomes more stressful for us. So that is very important. Also, I mentioned some professional development, making sure that people are getting enough training to feel
Mm,
like they are adequate to do their jobs. It's very important. Also,
yes.
work-life balance. I have not seen mental health nurses getting like opportunity to work from home, to have that work-life balance. You do see a lot of mental health nurses doing
Mm,
so much hours in a week, so much
yes.
hours, no work-life balance. You have to work because there's no one to do the job. So you're doing triple shift, double shifts is so hard and exhausting. We don't have the chance to do work from home. There's nothing like that. So
Mm,
it's quite hard. I believe the way mental health nursing is, we don't always have to provide service face to face. There are some
mm,
services that we can provide without having to see the client, and you will still feel like you're making a difference. I think we can move towards that so that we can reduce stress of some of our nurses. You come in today, you come in and on Wednesday you don't come in. You can provide your service from home. I think we will get there over time, but
yes.
right now it's still it's still very hard. Um, Also, we can also involve nurses in policy and decision making. Most of the decision making, even when the government remembers to do anything for nurses, they are not specific about mental health nurses.
Mm,
And you would see that the kind of generalization does not really work for mental health nurses. So we want some specific um, policies tailored to mental health nurses,
mm,
mental health clinicians in a way that we can feel like we're part of the society and we are well looked after. I think that would help also. Also, some peer support programs, just like I mentioned earlier, making sure that the we are looking after ourselves as nurses, making sure that my friend is fine, so that if he leaves, I know that if he leaves, I'm gonna be, swarmed with so much work. So I
yes.
have to look after my friend. Please don't go. Don't leave this job. Okay. So it's also very important. Yes. So those are the things that we can do to make it more sustainable and fulfilling for us. Yes.
And I think those points that you put out are very doable, especially the online working from home. I mean, I see doctors online, I see counselors online. Why not mental health nurses as well?
Yeah.
I think
Yeah.
that's very
Yes.
possible.
I believe so too. I believe we can get there. Yeah.
And for my last question of you today, looking to the future, how do you see the role of mental health nursing evolving, especially with the growing awareness and openness about mental health issues globally?
Yes. So I'll start with this one. Integrated care models, right from when a child is at a particular age,
Mm,
when they can communicate their feelings, we should be getting involved. When they go to their GPs, they go to their clinics to see the doctor, we should start from then. I believe we're gonna get there, where we can get mental health nurses working as a part of every primary health service, primary healthcare
yes.
providers, social workers, everybody working together. A mental health nurse can be attached to like 4 or 5 clinics where you bring so much, where they can do assessments for all the people there. So easily, um, we can easily identify issues right from the scratch. Okay, this person is
Mm,
actually through distress. This person is not feeling too good at the moment. This person is showing signs and symptoms of early onset psychosis. We need to actually start monitoring it. So if that's happening, I believe that we can be able to address both physical and mental health needs at the same time and prevent a lot of deterioration so that this person we are talking about can easily live a normal life, even though they could have easily deteriorated, you know. So I think that's
that's
number
right.
one. Another one is telehealth and technology.
Yes.
Believe that like we mentioned earlier, I believe that over time, I believe the role of mental health nurses is going to evolve past just going to the hospital every day, doing your job, trying to work with people who are very aggressive to your face and feeling not and making you feel unsafe. I believe over time we're going to be able to do more remote work, delivering your care remotely and making sure you can provide adequate help for people without seeing them. So we'll be able to utilize digital tools to monitor patients and provide support to them. And also preventive care focus. We can provide care in a way that will prevent any onset of any psychosis, any any mental illness. We can
Mm,
do we, stronger emphasis on early intervention, making sure that we can provide care as early as possible so that we can prevent any significant decline in mental health. So promoting mental wellness, reducing stigma, and intervention as early as possible. That's another one. Also, cultural competence. I believe over
yes.
time, I mentioned Africa and Asia having issues with their culture and how they perceive mental illness. I believe over time we're going to get there. We're going to be able to provide service and care to people that have mental illness because people will be educated enough. People in different cultures that have so much stigma, they will be
Mm,
educated and will be able to provide adequate care. Yeah. There's a lot of other
yes.
ones, but I hope, yeah, those are if we can get those four done at least, I think
Yes, you'll be
we'll be
happy.
happy. Yeah, 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 yeah,
Like I said, it's valid points and it's doable, and I don't think it's too far out in the future for that all to become possible.
exactly, exactly. Hopefully, in a few years, we can revisit and see if some of these things have been done.
And I hope
Yeah.
that this podcast also helps someone motivate a nurse to go into mental health nursing so that you can also just take a break and have that work-life balance that most have.
Whew, yeah, I want that, please. So that we have enough people working in mental health that a lot of us don't have to do so much shifts. You do your job, you go home. I do my job, I go home. Good work-life balance. You do
Yes.
less work and have more fulfillment. Yeah.
I hope that happens very shortly because I
Yes.
can see that you're very passionate about your position and your role, but I can also see
Yeah.
that the strain that it takes on mental health nurses.
Yes. Yes. It's so much strain. I can tell you that.
But thank you so much for joining me today. I hope you enjoyed it just as much as I do. It was great to get your insights into everything as well.
Thank you so much, Julie. I'm happy to be here and thank you so much for having me.
And your pleasure. And to all our listeners out there, remember to like and subscribe, and we'll see you in the next episode of Healthy Talks.